welcome monsoon rains after experiencing the flaming summer heat. But with the pleasant monsoon time arise certain diseases that we should avoid by taking precautions. The monsoon season brings some unwelcome guests that act as ideal medium for infection and unwanted disease. Let's have a look at one of the monsoon disease, diarrhea.
During monsoon, food and water are the two things that get contaminated easily. This eventually leads to diseases such as diarrhea, since this season is a time for germs and bacteria to breed in large numbers. Diarrhea is very common, happening in most people a few times each year. When you have diarrhea, your stool will be loose and watery. In most cases, the cause is unknown and it goes away on its own after a few days.
Diarrhea can be caused by bacteria and viruses which enter our body through contaminated food and water. Pathogens that cause diarrhea include norovirus, enteric adenoviruses, astroviruses, rotaviruses, campylobacter, E. coli, salmonella, shigella. Drinking unclean and impure water infected by microorganisms are the main causes of diarrhea. In addition, a high sugar diet, food allergies, problems with intestines can also lead to diarrhea. Parasites can enter our body through food and water and settle in our digestive tract. This causes infection in the intestine. One of the main problems with diarrhea is dehydration. The body loses a lot of water and electrolytes such as sodium, potassium, and calcium that are needed for the smooth functioning. It may also affect our kidney.
If the right precautions are not taken, it can be dangerous, especially among the children. Diarrhea is a common cause of the death in developing countries and the second most common cause of the infant death worldwide. Diarrhea is also a major cause of malnutrition in children under the age of 5.
Continued episodes of diarrhea can therefore cause malnutrition. Frequent diarrhea lasting longer than a few weeks is considered chronic diarrhea, whether it occurs every day or every few days. If you experience symptoms for several weeks, then your chronic diarrhea should be evaluated by a doctor.
Symptoms of diarrhea: abdominal cramps, abdominal pain, frequent watery fecus, nausea, vomiting, fever, dizziness from dehydration. Here are some tips to help you to prevent diarrhea during monsoon. Drink boiled water. Wash your hands before you eat. Avoid outside food and go for homemade hygienic food. Always eat well cleaned and washed vegetables. Avoid eating raw or uncooked food. Maintain personal and food hygiene. Wash your hands after every trip to toilet.
If you are affected with diarrhea, drink a lot of water because body loses a lot of water during diarrhea. Oral dehydration solution and zinc tablets can be used to treat diarrhea. Rotavirus vaccine is the best way to protect ourselves from diarrhea.
During monsoon season, our body is prone to infections, so we should consult a doctor when we experience any symptoms of diarrhea. You should maintain proper hygiene. It is the only key to prevent you from these diseases. It is important to take some precautions to stay safe and enjoy the monsoon to the fullest.